Welcome back, everyone. Super excited for my guest today. It is none other than Dr. Amreesh Khanna. And some of you may know if you haven't been under a rock. So, Dr. Khanna, a dentist, entrepreneur, leads OraQ AI, a startup revolutionary dental care with AI technology. He has 15 plus years of clinical experience and now specializing before in complex procedures. Also teaches at the University of Alberta and runs ADEPT Dental Education. Dr. Khanna founded Shine Dental Clinic and Caused a Smile to provide dental care to those in need. And Dr. Khanna's visionary approach is shaping the future of dentistry. So I couldn't be more excited to have you on the show, Amreesh. So welcome to the Two Sleep podcast.
Thank you so much, Greg. Really a pleasure to be here. Love watching your podcast and all the great guests you have on them. So I'm honored to be a guest today with you.
Yeah, amazing. Thank you for listening. I appreciate it. It's out there on just about every podcast platform for listeners. And I like that you said watch because we are putting them up on YouTube now. So, nice to have somebody with a smiling face. That's, pre-production. We were talking about that. You always have a smile on your face. And what a great calling card that is for what you're doing. So I want to start, from the beginning. So as a clinician, up in Canada, and I want to hear a little bit about the inspiration behind what you've started doing. So before you launched, like, where was that inspiration coming from to say, I got an idea? Because a budding entrepreneur myself with my own company and others that I meet along the way and have been mentoring, where did that inspiration come from for OraQ?
Yeah, no, love to share a little bit about my journey as a dentist that kind of shaped me to that to direction and founding what now is called OraQ AI. Taking it sort of way back, like I followed a similar path as many dental clinicians do, right? You get out of dental school. I did a residency for a year in New York, started practicing a lot of what you teach on, Greg, in terms of implant dentistry and full mouth rehabilitation. I did my residency at Montefiore Medical Center in New York City, so a big implant center, and came back to Calgary. Family was there, and I said, "Hey, I'm going to start doing this stuff and try to get my feet wet in as many practices as I could." So I worked in, some solo practitioners' offices, some group practice, a DSO, all these things, doing sedation dentistry, surgery, implants, stuff that they were maybe referring out or didn't have anybody to do that in house. So that's kind of how I started my journey. Through that journey, met my wife, who's also a dentist as well, and my brother was also graduating dental school too. So we said, hey, naturally, we got to get ourselves a practice and get into entrepreneurship, or what I thought was entrepreneurship. Let's put it that way. So bought our first location in 2012. And then, a big event happened in my life in 2013 that really started to shape and move me from being a traditional dentist owning a business to really shifting me to being a business owner practicing as a dentist, right? And what that event was the 100-year flood that hit Calgary. So I lived in the middle of it, and my dental practice was also just a couple blocks away from where I lived. And woke up to a call one Friday morning at 5 a.m. looking outside our window, and the streets are flooding, and it's a whole was essentially like a lockdown zone, call it, and something that we never would have believed could ever have happened. And so went from having my dental practice that we had just bought to losing the entire practice and getting flooded, trying to save the place, but really shifting into, for me, what I only knew, which is, well, I got to move to the next step. I got to rebuild. I got to figure out a way. I got to, find a solution. And that, I think, was something that, now when I look back, really was always ingrained in my mind, how I was brought up, from my parents, and always finding a way, finding a solution. If you work hard, you're determined, you'll figure it out, right? And so that is, sort of the mode that I immediately went into after kind of crisis and disaster mode, let's call it. And we moved into rebuilding a practice, and saying, okay, we reinvested, and how can we, how do I need to really make that shift again, as I mentioned, from being a dentist owning a business to being a business owner, but I'm practicing as a dentist, right? And how does that shift really help me understand the business of dentistry, understand just tenets of a business in itself, right? And so I started doing a lot to educate myself, and we're trained really deeply as clinicians, but I'm like, I got to learn about business now, and I got to learn about all these different things. So started joining the different business development groups, taking courses, certifications, like you name it, dove into all the financial sides of it. So I was a data geek, a junkie in the sense of like learning every possible thing I could. And through that time, we rebuilt, we were able to more than double the value of the practice, bought a second location. And that's when I really started to see the discrepancy around scale and ability to scale. And, I'm sure you see this in your world when you're teaching and supporting and consulting with dentists and practices. It's like no two dentists are the same. And even if they're in the same practice, they're not the same. And they might even own the practice together and they're not the same. Right. And so how do we bring that consistency, because that inconsistency piece costs a business a lot of money and it's costing patients a lot of care, right? And so at the end of the day, we want to do what's best for the patient, but how do we bring what we call in our world the mind and the wisdom of 1,000 dentists to every patient interaction and every clinician, right? And so that moved me into the journey later saying, okay, could AI machine learning really help with this? And so I went down that whole rabbit hole, started exploring things and seeing, okay, I think there's something here. And if I could leverage that technology to drive holistic precision care, personalized dentistry, and also help us solve the problem of getting butts in the seats by getting patients to say yes to dentistry, then we're solving a need that exists everywhere. So that was kind of my journey of call it the past 10 years.
Well, and what you're talking about, and you use a little bit different terms, but that whole sense of best practices and bringing that into play, right? That the accumulation of knowledge, if you will, and being able to share that, being data driven. And it's one of the things that is so important and critical to understand is that no two individuals are alike. Whether we're talking about patients and how they're going to receive information from us as we're trying to help them and share with them about any type of treatment, from a simple extraction all the way up to full arch, full mouth rehabilitation, like you shared so adeptly there. But also, it's that customized approach for clinicians, for anyone that's on our clinical teams, on our dental teams, right? From a dental assistant to front office to those answering the phones in lead call to the clinicians themselves, that they are all individualized. And that's why a customized approach within a framework, the framework can be similar. Here's what the patient journey looks like. However, it being customized depending on the person themselves. An example, I'm a very outgoing, extroverted person. You see me at a conference, you pretty much see me flitting around in every group. Well, it's okay if you're an introvert, but we still need to be able to provide tools for each individual in that environment, at a dental conference, to help an entrepreneur to be able to be successful in that environment. Maybe one is going to be more out front and center in a big group, and another might be more adept at the personalized one-to-one connection. But nonetheless, the framework's still the same. You go and make connections and network. And what you're talking about is that with patients and with clinicians, you have to customize that, but there can still be a formula. And what I want to ask you is then, how is AI able to provide better tools with all this cumulative learning, in the sense that OraQ AI is being able to enhance that? Because like you said, the one practice to the next, one clinician to the next, out of this 100-year flood, you were able to see, and couldn't agree with you more. Instead of being a dentist practicing business, you were a business owner practicing dentistry, and that mindset shift, everything, my friend. So please share.
Yeah, thank you. And I wanted to just touch on something that I think you said very nicely about, how we're all different just as humans and personalities, right? And your example sort of on the industry side and networking, but then tying it, as you mentioned, back to the patient experience and the journey. So something that we also looked at, and I'll make sure I answer your question about the AI, but we felt that exact same thing too, is that, well, no patient is the same. And if we can better understand the patient that we're talking to and equip the dental team, everybody on that team, to know, how do I better talk to that patient, we're going to get a better outcome, which is, at the end of the day, we're presenting them with care that we know is best for their health, but we need them to see the value in that and say yes to it, right? So I don't know if you're familiar with disc profiling, but it's one of the cool. So we actually incorporated DISC into our entire process, and I'll touch on the way we do that. But that's one of the key elements of our solution, that we engage directly with a patient even before they've walked in the door. And through a health history validated OraQ health history intake, from there we get a DISC we get to put a patient in a quadrant at least. So it's not your big like 50, 60 question one that we've done when we've got ourselves mapped out thoroughly, but it's been very accurate to throw them in a quadrant at least. So we know like the I, the extrovert, they're going to chat, our heads off in that conversation. They want to tell us everything. They want to hear about our life, all that kind of stuff. The D is like, just get to the point. Like, I don't need all the options. What's the best one? Like, let me know what to do. The S's and C's want all those details, right? And every option, and they want to go home and study it and so on, right? And so that's something that we try to give at the forefront to the dental team, so that know your patient before you walk in the door. And our hygienists are just loving this because they're like, okay, like at least I just kind of know how do I approach this patient before I walk into the operatory today, right? So that's something cool I just wanted to point out. And then from the AI side of things, you're saying like, how does AI help us do all of this better? And really, when we looked at the problem, it was kind of twofold. One is, how do we change the lens in which we evaluate a patient? And the only way we can change the lens in which we evaluate a patient is to make sure that we're evaluating all the right things in the patient in the first place, right? So if we've got, are we looking at everything regardless of our bias as it relates to where we've been trained, how many years we've been practicing for, what CE I love doing, what thing I'm so interested in. I'm an implant guy. Well, I've got an ortho guy or gal in the practice. Like, what's that bias that we bring to every patient, interaction? But we got to look at everything the right way. And so if we're looking at the right data, that's what the starting point is. The second piece is, how do we give meaning to that data in a quick and easy way that is not subject to bias from our human brain, right? And so what we do through our system is we said, okay, data is everything. You can't do anything with AI if you don't have the right data to begin with. So what is the data that we need to evaluate first in every patient that walks in the door for a recall, a new patient exam, comprehensive exam, spec, emerge, whatever it is? Look at the right things first. But if we can roll up that information into a meaningful, quick, and easy way so that now it guides the clinician to think about things differently, right? And so what we've done with that is our AI, we have 7 AI models that comprise what we call an OraQ wellness profile in this patient. We're looking at their oral systemic health connection, medical risk. We're looking at sleep disorder breathing. So evaluating, are they clenching, grinding because of, an underlying airway issue or obstructive sleep apnea? We're looking at occlusion, TMD, ortho. We're looking at biomechanics, so the crack risks in teeth, caries, perio, aesthetics. So those 7 models comprise that whole wellness profile. Now, like what our system does is, even if it's just a new patient, they haven't even walked in the door yet, from a health history alone, you can already see this profile starting to develop and be like, wow, I haven't even seen this patient. I don't even know Joe yet. But before Joe walks in the door, he's already starting to tick up on a couple of these dials here. I'm going to dive deeper in that in my conversation and my examination today, because something's going on there. Then as we do the examination, we keep evaluating, keep assessing that. And then that's when the mind and the wisdom of 1,000 dentists, which is the AI, all puts it all together into insights and recommendations to guide that precision care. So should this patient be on a 3-month hygiene interval rather than a 6-month? Should I watch that cracked tooth, or should I treat it? And if I'm going to treat it, do I do a crown? Do I do an onlay? Based upon this patient's bite profile, do they got recession because of periodontal disease, or is it due to an occlusal bite factor issue, right? So how do we piece all this together? And oh, by the way, what's happening in their medical history? I'm planning on doing an implant here. Is there anything I should be concerned about before I start, suggesting them surgical treatment? So all of that quick and easy and right there. And then we give that all back to the patient. So we're really about full transparency and ownership of that oral health data, so that the patient leaves with it in the palm of their hands. They got it on their mobile device, and they can now go home. So those S's and C's, as I was saying, want to go home, sit there, they're watching Netflix with their partner, and can say, hey, I was talking to my dentist, check out this, scan image that they talked to me about today. They told me I need all this stuff. Like, what do you think? Right? And that's going to change the conversation, and it already has. And that's what's really, increased almost 30 to 40% increase in terms of treatment acceptance, just because of patients having a different conversation now. It's not about codes and fees and line items. It's about, hey, well, what does that mean? I've got risk here. Like, how do I get that down? Right? And what's my long-term plan to get me there, doc?
I so love the parallels that we're drawing here, because we live in kind of different worlds, right? So I live in the fixed full arch world and working with clients, but the parallels here are just astounding, Amrish. So you're talking about the disc profiling, right? And so being specific with the patient, even before they come in, you're getting some intel ahead of time. And the way that I'm drawing that parallel is as we're working with treatment coordinators as they're getting ready to present treatment before they even get to the numbers of the treatment itself, right? Or anything that they're recommending from the clinical side in that sales presentation, that greet and build rapport, it's really all about the non-dental stuff, right? Get them talking about something they know, right? Because if they're going to present, and I always talk about the 7 different personality types, and you're talking about the 7 profiling pieces, because if you're talking to somebody who's an engineer, you're certainly going to start on the clinical side, be talking about the structure itself of the full arch, right? Of the teeth, of the how they're going to fit the prosthesis onto the abutments, onto the implants itself, and the load distribution. Makes sense. But if you're talking to an interior designer, you're certainly going to talk more about, how things are going to flow, how it's going to look, more of the artistic piece, right? How it's going to affect speech and how it's going to, those types of pieces, right? So that just like laid right into it. And I love that. And then you're talking about how we look through our bias, right? We look through our own bias lens. It's our own perspective. And that's the same way that of why we're taking patients through the journey and giving them an experience, how we're communicating with them, because the way that we're sharing a message is not necessarily the way it's being interpreted by the receiver of the message. Because, and the last piece, and I love this, right? Because the information you're sending them home with, in my world, in Fixed Full Arch, the plethora of information that they're intaking during one of those consultations, we're lucky if they're retaining 10 to 15%. 20%, they're really high end because they probably come in with a bunch of knowledge ahead of time, right, wrong, or indifferent. Then what we're doing is we're saying, great, this 20, 30, $50,000 procedure, they're all excited, emotionally invested if we've got them to that point. But most of the time, because it is a huge financial obligation that is going to burden, and I'm going to use that word intentionally, obligate, burden, right? The household financially for 8 or 10 years, unless they're going to slap down a check and they're on the extremes of the bell curve, which most aren't, right? They're going to then go home and talk to the financially interested party in their household, right? It's going to affect their kids, right? If you have kids that are like 5, 6, 8 years old, it's going to affect into their middle teenage years. Yeah, you think there might be some money that might want to be spent for a $600, $700, $800 monthly payment for the next 8 to 10 years, even if they're well deserving, even if they're in great need of it, even if it's going to help them. Still, they need to convince that interested party. And what you're talking about and what we teach and coach and train, right? It's not just that immediate follow up, right? That's personalized and all that. It's also that testimonial video, right? With the information so that they can share and continue on that momentum with that interested party. And that's what you're talking about. Enabling, right? Tools that enable that next conversation, giving patients the enablement that they need to be able to communicate the information and empower them to have that next conversation. That's where the biggest gap, I believe, is happening in dentistry when treatment isn't being accepted, rather than the data driven of, oh, there's 1.7 million dollars of treatment that's out there, why don't you go and get it, Susie, John, Jessica, at the front desk, why aren't you calling it? Well, have we given the tools necessary to our patients? Have we given them what they need in order to say yes? Are we making it easy to do business with us? And those are the things that you're talking about. Do I have that right? Am I drawing? Am I connecting the right dots here for what you do at OraQ AI?
Yeah, 100%. And I love what you're reinforcing here is, it's the patient, but that it's also the whole team, right? Like we have to enable the patient with the tools, but like you said, well, if we haven't given the patient the proper tool, well, how is, administrator, treatment coordinator, assistant, hygienist going to reinforce things? And then today I find often we're reinforcing it just in the way that we know best, right? So administrator is doing their best job reinforcing it in the way that they know best, right? And then hygienists, patients back in the chair, maybe talking about reinforcing it in some way. Clinicians, exactly.
Because they want to do well. They want to do well for the practice for the most part. And if we're talking about, the crunch on staff and getting, it's hard to hire good people and it's hard to keep them. are we investing in them in a way that helps them to be more successful in what they're doing, which also then helps our patients to be more successful in taking care of their oral health? And we know the mouth body connection. It's already out there. It's being well studied. It's not a big mystery. And so rather than the investment of, oh, should I give them, vision and, and other care, and should we do a 401k, and I do a trip every year with them if they hit their number, are Mr. or Mrs. or Ms. Dentist, right? Are you giving them the tools necessary to make them more successful?
Yeah,
Everybody wants to be successful at what they do. Hold them
exactly.
accountable,
And
but give them the tools. So yeah, sorry, I interrupted you, but
no, no,
I'm
no,
really
it's great.
passionate about this because that's what we do at GNA Consult. We give the tools, we help them with the tools. Then it's a matter of, do they want to use them, right? Do they want to take advantage of the opportunity, just like you did by saying, look, I went to these business development, like I knew I needed to be a business owner practicing dentistry, not a dentist, who was a business owner, right? Because you took it on yourself. You said, I need to change, I need to modify. And that's what we need to give our team members, the skills, the tools, the enablement tools, and then it's up to them. We hold them accountable, but it's up to them to be able to actuate on that. And am I hearing
Yeah,
right? Is this
yeah, yeah,
landing with you? Is
100%.
this what you're doing? Yeah.
And so with OraQ, like what we do with that patient review and the what goes to the patient with their portal, their wellness profile that I was sharing before, now we've aligned the tool for everybody to be talking about the same thing, right? So now if the patient calls and says, I got a question to treatment coordinator about what was treatment plan, the patient's got their portal up in front of them. The administrator's got the portal up right in front of them. So instead of looking at the traditional odontogram and the Dentrix treatment planner and all that kind of stuff, they've got the risk dials. They've got the reasons why this treatment plan was recommended. So now when Joe's asking, do I really need that crown? Or I'm going to give a kind of more general example versus full arch kind of thing. But, do I need that crown, or why do I need to come in 4 months for hygiene? I've been coming 6 months for all these years. Administrators got that right there. Hey, look at that. You got your patient portal up in front of you. Do you see your periodontal risk, or do you see your bite risk? These are the reasons. So it's up to you if you want to do this or not. But we're trying to work on reducing your risk so you don't have problems long term. We're talking about the same piece. The patient comes back, they're in the hygiene chair, they're talking about the same piece. The dentist is talking about the same piece. So I was on a conversation with a dental group just last week, and they were saying they have this, like, I always talk to dentists and say, hey, we all think our treatment case acceptance is amazing. And I'm guilty of that too. But in your world, you probably know that it's not as good as we probably think it is. And and this practitioner was telling me about their awesome process. Like they've got a detailed process where he follows up with a video after reviewing the treatment, linking it to educational materials, all this stuff. Then he's got an administrator that follows up with a phone call. So I was like, yeah, you probably do got a pretty high treatment acceptance rate. But think about the time they're putting into that. So my thing was, are you doing templates? Are you making a PowerPoint? You've created some Word templates, whatever you're doing. And they said, absolutely. Well, I was like, what if you could look at this all just the moment the patient sat up in the chair? They've got it all in their hands through their OraQ wellness profile. They leave. Even if you want to do that video still, that's totally fine. But you pull up their OraQ wellness profile and you're talking to them exactly what you showed them in the office. And they've got that in the palm of their hands too now. And then when they call back to talk to the treatment coordinator, they're talking about the same thing. So it's that tool that now we've made it easier and more efficient, but we've also aligned everybody around that same piece. So back to what you're saying about the team wants to do well, right? But if we give them the tools now to execute well on that, and rather than just giving them an outstanding treatment list and saying start from the top and work your way down, they've got the patients that need it, the patients that are high risk, and we know the patients that are motivated to want to do the dentistry.
Well, and as you started speaking in this section, the first thing that I thought of is, what's the most expensive thing in any practice, right? It's the doctor's time. And then you talked about this, and it's not just that, and also it's the efficiency piece, right? The efficiency piece of bringing in technology. And it's really what everyone's talking about, which is, how can I utilize technology to enhance what we're currently doing, to improve upon, and not remove the human touch, but to enable it to be more efficient, right? Because that's really the key. And the data driven piece, it's not just do I get statistics, because we help our clients hold marketing companies accountable, right? The lead generation is great, give the leads, but then how do we track where it's coming from, what source? And instead of saying, oh, the leads are crap, well, how good are your people who are taking the lead calls? How quickly are you following up? How are so it's what data and what metrics are you holding accountable to? And then what is the time cost? What's the opportunity cost if you're spending time doing these tools? And I'm sure the conversion rate is much higher, right? With that personal touch that they're doing. But where, what are they giving up in the process? And so I don't want to bag on that, because I love that, because we talk about that as well, as options to be able to do, especially in the larger cases, right? Every personal touch you can possibly do that's personalized to a particular patient is going to
Yeah.
increase the closing rate. So I love that. All right, Amreesh, here's the part of the program everybody plays a little something called What the Sleuth is Going On? 3 rapid fire questions. First thing that comes to mind, are you ready to play?
You got it.
All right. Question number 1. What's the worst bad breath you've ever encountered?
Oh, I've had some good oozers where you're gonna be doing a maybe a full mouth exo case or something, and you barely even come near the patient, and you're just putting suction in the mouth to freeze somebody, and you've got some good oozy abscesses. So that would be the worst.
The
worst
fact
bad
that
breath
you just said you've got some good oozers, that's a new one. The oozers, I like it. We're definitely friends now that you use the term oozers for sure. Oh, thank you for that. All right. Question number 2. I hesitate to ask this question because your smile is amazing. If you could change one thing about your smile, what would it be?
Ooh, that's then thank you for commenting on my smile. I don't know, maybe I gotta get some reshaping on my pointy canines here.
Is that what? Okay, I'll take that. I don't know. It adds definition. You're always smiling, so I don't know. I wouldn't change anything. Like people know that you're always smiling. So pre-production, I'll share with the listening audience. We were talking about that. I'm like, you're always smiling, Amreesh. Like I always see you smiling. And do you want to share the rest of the story? And then I'll do question 3. Share the rest of the story about high school if you don't mind. It was great.
Yeah. I was telling Greg that back in the day in high school, when we'd all try to pose with our hardcore tough guy looks and everything like that, I would be always the one still smiling in every one of those photos because I could never do a straight face. So all my friends would just laugh at me and be like, man, you always got this like car salesman smile on your face or something like that. And I'm like, I can't do the tough guy like straight face pose. So now it's being appreciated later in my life, right?
And we're gonna call that Canadian nice. We in the States would call that your badass pose.
Yeah,
so you don't have a badass pose because you're always nice. You're always smiling. All right, good. All right, back to the questions. All right, question number 3. If you could go back and be the inventor of any dental product, and no, you cannot choose your own, which one would you choose and why?
Ooh, that's a good question. I don't know how I can rapid fire that one. I'm gonna say I would invent the dental implant because I do love implant dentistry, and I love what it's done to change the way that we were able to provide a whole new level of care with patients and everything from everything that you do, and it's something that I was super passionate about through all my clinical years and still am today. So I would geek out and nerd out on implant dentistry and surface technology and osseointegration and all that good stuff.
It's kind of crazy that we just put like a titanium screw in people's jaw and then a post and then put a crown on top and it works. I mean, I still to this day, when I like go back to like the fundamentals of implant dentistry, that's just kind of cool. I mean, I know you can go back to like the blades and the, all those to the periosteals, but when you think about like the endosteal, I always get that word, endosteal implant. I find it fascinating, truly. All right, well, my friend, in the last few minutes, if there's anything I haven't asked you that you'd like to share with my listening audience about yourself, about your company, please, I want to open the platform and give you a few minutes to do so.
Yeah, no, thank you very much, Greg. Really appreciate again the opportunity to be on here and have a great conversation with you today. Always open to chat more with any of your listeners. If they'd love to learn more about OraQ, they can visit us at oraq.ai, and I'm sure you'll share our contact info and everything as well with your podcast details. And if it's just even about business and entrepreneurship and all the other things we were talking about, at the start of our pre podcast call too, we were just talking about being real and all the things that we go through this journey, right? And what we have gone through to kind of get to where we are today. And I know I'm fortunate that I have great friends, colleagues, and new dentists who'll reach out now and say, "Hey, I'm thinking about doing this. Where do I start?" So I love those conversations, and always more than happy if I can help in any way.
Yeah, I love that. And I have those same conversations with industry partners. So thank you for offering that up. My guest today on the Two Sleuth podcast has been Dr. Amreesh Khanna. Good luck with everything with OraQ AI and just in life. You're one of the good ones. You're a good friend. And I can't wait to see you on the road sometime soon. Have a great rest of your day. Thank you so much for being a guest.